Good afternoon. My name is Catie Kelley, and I'm a policy counsel attorney with Americans United for Life. But my background is in prosecuting healthcare fraud and the physical, emotional, and financial abuse of vulnerable adults with physical and mental disabilities. Today, I urge your opposition of House Bill 254. Representative, earlier you asked us to consider, and you asked the committee to consider specific terms of the bill that we might oppose. I asked y'all to look to section 137-M4. Here, a healthcare provider is only required to refer a patient to a mental health professional if the physician, quote, has doubts as to the mental capacity of the patient. But a physician does not even have to formally evaluate a patient requesting physician-assisted suicide for depression or any other mental health conditions that might impact their decision-making abilities. In New Hampshire, 25% of adults have reported a depression diagnosis at some point in their lives. This means that at least 1 in 4 individuals requesting medical aid in dying under this bill may be suffering from depression. And under this bill, they will not be adequately screened by it. Studies in primary care settings suggest that only about 50% of depressed patients are recognized, and that number is even lower for elderly patients. The standard of care for patients with end-of-life conditions requesting to end their lives ultimately requires that physicians evaluate and treat patients for depression and suicidal ideation. Well, under House Bill 254, that requirement is not here. In conclusion, House Bill 254 will result in discrimination against vulnerable people suffering from depression. I respectfully ask you all to review Section 137M4, review the doubts provision, and consider that that is only one of the many flaws in this bill. My written testimony has also been submitted online. Thank you for your consideration today.
Thank you. Representative Perez.
Thank you. Thanks for taking my question. Is it reasonable to say that anyone who is in the last 6 months of their life who would request this would be somewhat depressed?
Yes, Representative. Studies actually show that poor mental health is comorbid with chronic illnesses, such as diabetes, heart disease, and these are even more common in elderly patients with hidden depression. And so you're absolutely correct.
Any other questions? Seeing none, thank you.
Thank you.